year. So I'm typically in the operating room 1 to 2 days a week, full days a week. And then I'm in clinic 3 days a week. And then I was lucky enough last year that some of my patients actually donated money. So now I'm doing research. So I had a research fellow last year. So then I've had to squeeze that in too. So usually at least half a day a week or 1 day a week, I try to also do some research, which has actually been very exciting because there's a lot to research in glaucoma. And then I would say in terms of surgery, one of the things I love about glaucoma is how many surgeries I do. I alluded to this earlier, and I think Margot can speak to this. Like usually my surgical schedule is like 6 to 10 different surgeries. So it's, I never get bored in that sense. And then in clinic, I typically see like 40 to 50 patients a day. So it's a pretty heavy clinical schedule. But I really enjoy it because in glaucoma, you get to know your patients. You typically see your patients at the minimum twice a year. And sometimes if you do a trabeculectomy, something like that, a complex surgery that requires a lot of follow-up, I end up seeing them 20 times in 3 months. And you really get to know them and they get to know you. And it's almost like they're part of your family. And even though it's glaucoma, I would say the 40, 50 patients I see in a day, there's always surprises, right? There's a patient that comes with a pressure control, there's a patient that comes with a pressure of 50 and you have to do urgent surgery. And I find that kind of exciting. Also, there's a lot of troubleshooting in my clinic. If someone has an allergy to a drop, I have to think about what other drop to do, or am I going to do surgery? Am I going to do laser? Which one of the 29 different surgeries is best for this patient, which is really exciting. And now that I've started doing research, I think working with the medical students, working with the fellows, working with my research fellow last year has been very exciting. Just trying to look at the new surgical techniques in glaucoma that, as I said, every couple of years we have something new that we have to study and compare to what's already been published is kind of exciting. So that's basically what a week more or less looks like. Pretty busy, but very exciting. Always something new.
This year, I really get to wear 2 different hats, which is really exciting. So as the director of the trauma service, I manage all of the open globe injuries, which are full thickness injuries in the eye. So the surgeries are really exciting. You never know what to expect. It's always a challenge. And I get to do these surgeries with our senior residents who are all incredible surgeons, but it's really the highlight of my year watching them grow every time we're in the OR as they learn new skills and they get better and they gain confidence. It's really a unique position and something I've really enjoyed. In part of that role, I run bi-weekly clinics on Mondays and Fridays for all of my trauma patients. And within that clinic, I do cataract evaluations for patients with traumatic cataracts. And I also do the cataract surgery with the senior residents as well. In my other role as chief resident, I'm in charge of teaching the junior residents our basic science curriculum. So I meet with them Monday, Tuesday, Wednesday mornings for an hour and a half and teach them the basics of ophthalmology to build their foundation and their clinical knowledge. And then I organize Friday lecture series as well as wet lab sessions for the residents, and that's for the entire residency, not just the junior residents. So my day-to-day is basically creating a balance between providing excellent patient care for my trauma patients and ensuring that all the residents get the most out of their training, in addition to organizing the schedule for all 24 residents so that they're in the right place at the right time, but really getting all they can out of Mass Eye and Ear, which has so much to offer.
So as part of the Harvard ophthalmology program, we cover all the different Harvard hospitals. So as Dr. Lork mentioned, that's MGH, that's Brigham and Women's, that's Beth Israel, Boston Children's. We also cover the VA here, and we also go to a VA up in Tokus, Maine. Each of those hospitals has a slightly different kind of culture and approach for the ophthalmologist, which is actually really fun as a resident to rotate through these different hospitals. So at MGH, they're right next door. So we are very closely intertwined with them in terms of functioning in their emergency department, being consulted for inpatients. We work closely with the neurosurgeons there, particularly when we're on oculoplastics and with the ENT on kind of various orbital tumors or processes that may involve kind of these adjacent parts of the body. We go over to Brigham, and actually we, as the consulting ophthalmologist, are one of the only ophthalmologists in the building. So we have our own kind of opportunity to have a fair amount of independence, as well as a chance to basically kind of run our own service with plenty of supervision and lots of people to offer us advice and help. But that kind of just gives us a chance to spread our wings. I think once we finish our first year and we're into our second year, we've built that clinical acumen to then apply that in a slightly broader setting. Working at Beth Israel, we see, again, we're working in the emergency department, we're working in the inpatient service, but we're also working closely with those physicians and seeing a slightly different practice pattern. At Children's, it's an amazing institution of, again, we think of Mass Eye Near of having all these kind of subspecialties. Then you go to a children's hospital that has, you know, all these pediatric ophthalmologists in each pediatric subspecialty. You know, they have uveitis and they have pediatric trauma and pediatric glaucoma and pediatric retina, and then working with all these really intense clinics that, again, are just so subspecialized. There's things you'll never see again that you see in clinic while you're working there and working with those specialists. Of course, working with the veteran population, both here and up in Maine, is also a very important part of what we do. And they really give us a lot of chance to be independent practitioners as well, and really kind of take ownership over patients. So the diversity of clinical experience we have across the hospitals is huge, and each one has its own environment, its own culture. In terms of collaborating with other specialties, definitely, constantly. I think one of the coolest things as an ophthalmology resident and as someone who's interested in education is that we think back to medical school and you get what, like 8 hours maybe of eye lectures for all of medical school and no clinical rotations unless you want them. And so you have a chance really to interact close with people, to educate you know, people in other specialties who are interested and just don't get the opportunity. On how the eye plays into their role, you know, talking with ICUs about appropriate lubrication for patients with kind of these open eyelids who are under intubation, and talking with, you know, trauma about the role of, you know, not letting people, you know, blow their nose when there's a fracture because you don't want air up behind the eyeball, and kind of all these different subspecialty areas. So we get a chance to work very closely with people across different services, as well as for us to learn from them in terms of the ophthalmic manifestations of systemic disease, which has been a really kind of eye-opening experience working in these really complex hospital systems, seeing very sick patients and seeing how that disease manifests in the eye.